Welcome all the audience and subscribers of Life Made Up of Questions. Today, our guest is Dr M S Jayasekhar, a plastic surgeon, consultant plastic surgeon at Suvarna Aesthetics Plastic Surgery Center, Trivandrum. He is a senior person with hands-on experience in this field. So, welcome you, sir, to this forum.
Thank you, Mr. Harishan, for inviting me to the forum. It's been a pleasure meeting you and sharing my experiences with you. And as you rightly said, I'm a consultant plastic surgeon. I work for Suvarna Plastic Surgery Center, which is based in Trivandrum in Kerala. I've got nearly 3 decades of experience in the field of plastic and cosmetic surgery. I did my initial training in Trivandrum Medical College, and then I moved on to UK to have my further training in cosmetic and plastic surgery. I did my FRCS from Royal College of Surgeons of Edinburgh in 1995, and then I worked in the UK for several years. Then I moved back to India in 2010. So I think it's, as you know, this is a very new field, and there's a lot of interest for a lot of people about cosmetic surgery. So do you want me to discuss on any particular aspect of this cosmetic surgery, or do you have any interesting fields? Do you have any sort of interesting topics that you want me to elaborate on?
Yes, actually, we can start from the scratch, like from the basics. Many people may be having some doubts regarding what is plastic surgery. Is there any side effects on doing a plastic surgery? And what is the difference between plastic surgery and cosmetic surgery? So let's start from these concepts.
Yeah, okay, that's fine, sure. As you know, the word plastic surgery, do you know how the word originated? Plastic surgery comes from the Greek word plastikos. That means the human body can be molded like wax. In a plastic surgeon's hand, human body is like a wax statue. He can mold it the way the surgeon wants. So that's how the term plastic surgery came. It originates from the word plastikos in Greek word actually. So plastic surgery, I mean, it's a specialty developed to overcome all sort of problems, all sort of deformities, deformities that humans suffer from. It could be a deformity from birth, or it could be a deformity following an accident, or it could be a deformity following cancer. So whatever form or burns, whatever form of deformity anyone has can be rectified through plastic surgery. So it's a very broad specialty. For example, we know a lot of our children are born with cleft lip and palates. So which is an unfortunate thing. They're born with an incomplete face, with a cleft lip or a palate, which is again corrected by the plastic surgeon. Similarly, I mean, a lot of our people meet up with road accidents or many industrial accidents, and they lose part of their face, part of their arms. Sometimes their hands are being cut off, by in industrial accidents, or even by other fights and things. So all these things can be put back. If somebody's finger or hand is cut, the plastic surgeon puts it back. It's called microsurgery. We work under the microscope. We will stitch back all the cut off blood vessels, nerves, everything. So we can put the fingers and the hand back, and so the person will gain back the lost organ. So that also comes under plastic surgery. And a lot of people suffer from burns, especially a lot of women. They suffer from burns in our country. So again, with burns, they have a lot of deformities. They can have scarring of the face, they can have scarring of the neck. Sometimes whole body can be scarred and burned. So all these people can be given a new lease of life by doing plastic surgery techniques like skin grafting, tissue expansion. So there are a lot of new avenues, new areas where you can actually reconstruct a burns patient and bring the patient as a productive individual to the society. The same thing also is true for cancer patients, because oral cancers, people who smoke or people who chew tobacco, they tend to have oral cancers, and the cancer can affect their cheeks, their mouth, their lips, and the tongue. So once you have an oral cancer, that portion of the body will be, removed surgically. And then again, they will have a very bad deformity. So it's actually the plastic surgeon who can reconstruct all the lost portions of the face. So that again is a big field of work for the plastic surgeons. So if you look at it, we are involved in every stage where people suffer from deformities are being corrected. So that is in plastic surgery in general. Now, moving on to cosmetic surgery, as you have asked me, cosmetic surgery is actually a luxury. Plastic surgery is a essentiality. It's actually required because all these people I've told you, they require plastic surgery because they're having problems. So plastic surgery is an essential thing. It's an essentiality, whereas cosmetic surgery is a luxury because the people who come for cosmetic surgery are normal individuals like you and me. They don't have any deformities, but they want to look better. So those are the people who come for cosmetic surgery. Let us say, suppose somebody comes, and says that my nose is not looking right. I want to beautify my nose. That becomes cosmetic surgery. So we do a nose shaping operation called liposuction. Sorry, it's called rhinoplasty. A nose shaping operation is called rhinoplasty. So that again, it's a beautifying operation. And sometimes, ladies will come for all sort of beautification. They say, I'm not looking fair. I won't have most complexion of my skin. So we do a lot of treatments. We do skin whitening treatments, lasers, chemical peels. So these are all cosmetic procedures. And similarly, and some people who put on weight, they say, I've got enough fat in my body. I want to reduce my tummy. So we do liposuction and we suck the fat out. So the tummy gets reduced. So these are all cosmetic procedures which normal healthy people come to get themselves look more better. So plastic surgery, as I told you, is an essentiality where real people who are suffering from deformities come for surgery, whereas cosmetic surgery is normal human beings, normal people like you and me who haven't got any deformities, but they want to look better. They want to, improve their looks. And now, that's a very important thing because, as you know, in social media, people are, posting pictures, selfies. You've been you're working in the social media side, you know that. You'll take Facebook or Instagram, it's all pictures, pictures, pictures. So everyone wants to look good in these pictures. So the need for cosmetic surgery has gone through the roof over the last few years. Maybe about 15 years back, not many people used to come for cosmetic surgery. But I think with the advent of Facebook, with the advent of other social media like Instagram, where people are reels, where people are putting in a lot of the videos and photographs, the importance of looking good is getting really important. And so a lot of people are coming for cosmetic procedures to plastic surgeons. So these are the differences between general plastic surgery and cosmetic surgery. So do you want to highlight on any cosmetic surgery procedures? You want to ask about any particular procedures, or you want to move on?
Yeah,
Harish,
actually,
do you want?
yeah, yes,
Yeah.
we can go to the next stage. Actually, in the case of the procedure, coming into the procedures, like a normal surgery, and we are having some keyhole surgeries are also there. When coming to plastic
Yeah.
surgery, what are the detailed procedure and how that surgery being done? Like it can be done on local anesthesia or real time, like straight straightforward. Like what is the procedure actually? It's a detailed procedure or simple procedure?
I mean, some of the things are very simple. You can do it under local anesthesia. A lot of minor procedures like removing the scars, removing the tattoos, or removing bags from your eyelids. When people get old, they get bags, under the eyelids. So all these things, or even correcting the lip. Suppose somebody has got a thick lip, you want to thin the lip, or somebody has got a mole or a scar or whatever. All these things can be done under local anesthesia, even lifting the eyebrows. And sometimes people have problem with the ears. Some people have very prominent ears called bat ears. Nowadays we don't call it bat ears, we call it prominent ears. So all these people, they can be done under local anesthesia, and it's done as a day surgery. In fact, I would say about 70 to 75% of our work is done as day surgery procedures, where the patients can have local anesthesia and they can get rid of all these deformities and they can walk off. But you asked about the keyhole surgeries like liposuction or putting breast implants. Again, that's a small incision through which we put the breast implants to make the breast bigger for ladies. Or sometimes we reduce the breast also for the ladies, and sometimes we reduce the breast for men also. A lot of young men have big breasts called gynecomastia. I'm sure you would have heard about it. A lot of
Yes.
boys, these days, they have huge breasts. Some of the breasts look like women. So these boys, they get taunted at school or college, and they have a lot of psychological problems. So when they come to us, again, it's a keyhole procedure that we do to reduce the breast for the boys. So all these procedures are done under general anesthesia, which means at least for a night, the person has to stay in the hospital and they'll recover overnight, and the next day they can go home. And similarly, for the ladies, we reduce the size of the tummy. It's called tummy tuck. This is done for the ladies who had 2 or 3 babies and their abdomen looks very flabby. They've got a lot of fat, they've got loose skin, the abdomen becomes shapeless. So when they have all these problems, they come for tummy tuck, which again is done under anesthesia procedure. So these are the big operations. Otherwise, I would say 70% or 75% of the cosmetic procedures can be done under local anesthesia, like putting filler injections. Suppose somebody has got a lot of wrinkles, after the age of 45, 50, people will have wrinkles. So you want to smoothen the wrinkles, you can put in injections like Botox, you can put in injections like fillers. All these things can be done under local anesthesia, minor procedures. So most of the things are done under minor local anesthesia procedures, where the patient can spend about half an hour, 1 hour in the hospital, recover and go. Whereas the keyhole ones that you asked me, like doing liposuction or doing a nose job, even correcting the shape of the nose is an important thing. You cannot do it under local anesthesia because you're making the cuts through the inside of the nose. So the patient has to be under anesthesia. So you do the shape changes by making small cuts on the inside of the nose. So again, the person who has a nose job needs anesthesia and he needs to spend time in the hospital, at least for a day. Okay.
Yes,
So
so it's quite clear. So as you
yeah,
have mentioned, the sucking of fat, that fat is
yeah,
actually, I had read in some journals or articles that it can be called as gold or something, like it can be reused in the same body in some other part.
yeah,
Is it like that?
yeah. I mean, we do that. I mean, suppose somebody has got a big belly, but his cheeks are sunken. They don't have enough cheeks. What we can do is we can use the fat that we have sucked off from the belly. We can clean it, and there are so many instruments which we use, including centrifuges, to clean this fat. And then we load this fat in syringes, like just like the ordinary syringes, and then we'll inject the fat onto your cheek. So when you don't have enough fat in your cheek will look sunken. So this fat, what you have taken from the belly, can be used to inject into the cheeks. So your cheeks will become fuller. So same thing, you can do it for any other parts. Suppose a person has got, hollowing under the eyes. Again, this fat can be used to correct the hollowing under the eyes. So yeah, that it's a sort of a recycling. Yeah, and your own body fat can be recycled and it can be injected to other areas of your body. That's the advantage.
But it cannot be used it can be used on the same person only. It cannot be used on
Yeah,
different people.
it can only be used on the same person. We cannot use it on other individuals. And but a lot of celebrities are what they're doing is this fat, especially Madonna has done it. Pop singer Madonna. She
Yes,
has used her body fat. She, I mean, undergoes periodic liposuction. And the fat removed from the body, she makes soap. Fat is used to make soaps.
yes,
So
yes.
she makes a nice perfume soap out of the fat that's being sucked from her body. And she sells the Madonna soap to her fans. So maybe celebrities can get an idea from Madonna and they can start marketing it in India.
Yes.
People can do that if they want. Yeah.
As you have mentioned that injection for skin tightening and other recycling process, is there any side
Yeah.
effects or any use of steroids is coming into such condition?
No, we're not using steroids. We are using two things. One is Botox. Botox, I mean, again, can have some side effects because if you are not careful the way you inject Botox, sometimes you can have a little drooping of your lip. The corner of the lip can be a bit droopy after Botox injection, or you can have problems in closing your eyelid if you inject near the eyes and all. So, without experience, if somebody does that, these complications can be expected. Filler injections are relatively safe. Filler is actually the dermis. Dermis is made of collagen. Collagen is a protein that gives thickness to our skin. So the filler is made up of collagen, which is a protein which is compatible for the human body. So if you inject the filler, that collagen will actually give thickness to your skin. That's the principle. A filler doesn't cause any side effects, but again, if it's done by inexperienced people, it can cause a lot of swelling, bruising, all these things are possible, which is done by an inexperienced person. Okay.
When coming to the chemical peeling, as you have mentioned, it's a cosmetic procedure. We are having different
Yeah.
classes of peeling, like acid peeling and all. When actually the concept is that the skin will be, the top layer will be going and new skin will be coming. But what about the
Yeah, precisely.
pigmentation or the underlying decolorization? It will, in a recurring chances are there, no? Like undergoing a peeling process.
Yeah, I mean, see, we do peel to remove the top layers of the skin, as you said. So along with the top layer, a lot of pigmented cells will also go. So the pigmentation will be reduced, no doubt about it. But just by doing peel is not enough, because after doing chemical peel, again, if you walk in the sun, you know how hot, how harsh is our sun, Indian sun. So after the peel, if they just go and walk in the sun, you become black again, you get tan. So the most important thing after peeling is you need to put sunscreen. Everyone, even there are sunscreens for children these days. So sunscreen gives us a lot of protection from the sun. So if you put sunscreen in the morning, it protects you from all the harmful rays of the sun. So your skin is protected. So the skin doesn't become black. It doesn't get black, or it doesn't become pigmented. And also the water content of the skin stays in the skin, and it doesn't dry out. I mean, especially for people after 40 years, putting sunscreen is very, very important. So just by doing chemical peel alone, you won't get rid of the pigmentation. After the peels, you have to protect yourself every day for the rest of your life by putting sunscreen. And sunscreens don't have any side effects. And nowadays, you have sunscreens in the form of gels, creams, ointment. So it comes in the form of lotions. So you can choose the sunscreen of your choice. And that's very, very important to protect your skin after the peels.
Yes, then coming to the other part, like regarding what is the role of plastic surgery or cosmetic surgery in case of hair, that's hair replacement and hair fixing. Is any role?
Yeah, hair replacement and hair fixing are two different things. Hair
Yes.
replacement is done by plastic surgeons, and it's actually, hair transplantation. So when you don't have enough hair on the front, you take hair from your back or from your side, or sometimes even from the other parts of the body, like the chest, or even from your chin. You take the hairs and then you put it in the areas where you don't have enough hair. So that is called hair transplantation. And nowadays, the latest technique is called FUE, which is follicular unit transplantation. So you do one hair by hair. You individually put the hairs individually into the areas where you don't have the hair. So that is hair transplantation. Hair fixing is not done by the surgeons. That is done by the hair technicians. That wigs and even patches, hair patches, all these things are hair fixing things. That is done by the technicians. That's not by the surgeons. What surgeons do is hair transplant. So hair transplant is a very popular procedure now. So a lot of people are doing the new technique, that is a follicular unit extraction, FUE technique, which takes a lot of time. Suppose you want to put in 10,000 hairs, it'll probably take about 5 or 6 hours, because it takes a lot of time to plug the hairs and put each individual hair by hair, on the areas where you don't have hair. Yeah.
So I think I have generally covered all the areas. So just going to the last part, what are the latest technologies coming into this plastic surgery? Like as you have mentioned, from
Yeah.
periodically now in the current scenario, what is the latest updated technology in this field?
Update technology, we are using, laser liposuction, for laser. We are using laser for a lot of things. We are using laser to get rid of marks, unwanted hair, scars, all these things. Laser is being used. Now, laser or laser liposuction is a new tool which is being used in plastic surgery. And then for nose shaping and all, we are using the piezo, the piezo electric effect, we are
Yes,
using
yes,
the
yes, sir.
piezo osteotope. So piezo, as an engineer, you know the piezo electric effect. So we are
Yes.
using the piezo osteotope. That is precision cutting, For precision cutting and shaping of the nose, we are using piezo osteotome and a lot of new things like that. And another thing is we are also, robotic surgery is not very popular in plastic surgery because robots don't have the imagination. In other fields, maybe in gastrosurgery, you can use a robot, but robots are not popular because robots can't think like humans. to be a plastic surgeon, you need to have a lot of imagination, you need to have a lot of skill, you need to have artistry. All these things are lacking in a robot. So we are not into robotic surgery. And another important thing is now face transplant. You would have heard about face transplant. We haven't done it in India, but in US and France and all, they have done face transplant. Suppose a person's face gets disfigured completely after a burn or an accident. It's ugly and scarred. What you'll do is when somebody dies in an accident, somebody gets brain dead, we remove the whole face of the person who is on the ventilator with their blood vessels, nerves, everything, and we put it in this place in the scar face. This, the person who has got the scar, we'll put the new face on the scarred person's face, and we'll reattach all the blood vessels. We'll reattach all the nerves. So the person with a disfigured, ugly face will have a new face. That's a very new concept that is being it's catching up. I won't say it's done that frequently. It's catching up in America, in France. I think even UK they have attempted one. But in India, we have a lot of ethical issues because people don't want to donate the face of their near and dear ones. So we are having ethical issues with that. Yeah.
Yes, doctor. Thank you for this wonderful evening. So my best wishes to Dr. M S Jayasekhar, plastic surgeon, for sharing his vast experience and the updated technology in this emerging field of plastic surgery. So I hope that I'm sure that this is a wonderful session because, as you have mentioned, it's the beauty of plastic surgery. We can reshape, resize, and the creativity is also coming. So thank you, doctor, for sharing this evening. Have a nice day. Thank you.
Thank you, Harish, and thank you very much for your input, and thank you for all the support. Thank you very much.
Thank you.